The FDA is expected to grant full approval for the Pfizer vaccine as soon as tomorrow, and health experts say that might be the driving force for more Americans to get vaccinated. All of this happening as many southern states are reporting a surge in COVID cases, pushing hospital ICUs to the max. NewsNation's Felicia Bolton has a closer look now at how full approval of the Pfizer shot could help in the fight against the coronavirus. Felicia.
Well, Rudabeh, some people say this could be a game changer. Many people have been quite skeptical to receive the COVID-19 vaccine because the FDA has only granted emergency authorization for Pfizer, Moderna, and Johnson & Johnson. But experts say the data is now overwhelmingly clear. The vaccine is safe and effective when it comes to preventing COVID-19 and the symptoms from it. If the FDA goes through with a full approval for Pfizer, it will likely ease the minds of people who are vaccine hesitant.
As a COVID-19 surge sweeps the South, many frontline workers are hoping the FDA's full approval of Pfizer will lead to more people getting their shot. Jake Perkins is an ICU nurse at UAB in Birmingham, Alabama.
There's just nothing like walking into work and seeing what we see.
Perkins is caring for more than 190 COVID-19 patients in the ICU. Of those, 36 are vaccinated and 157 are not. The CDC says nationally, recent cases are mostly happening in those still unvaccinated, and the outcome can be deadly.
A lot of these people have not been conscious in a few weeks. Some, as soon as they are conscious again, are asking about their family, their loved ones, asking for the vaccine. And all we can really do is put a camera in front of you and hope that you can at least talk to some of your loved ones.
In Alabama, it's leading to more hospitalizations of pregnant women and children.
There definitely has been a surge with the Delta variant, which we're still learning a lot about. It seems like this variant is affecting children differently than what we dealt with at the beginning of the pandemic and really in most recent months.
It's a problem U.S. Surgeon General Vivek Murthy says can be solved if more people get vaccinated. So far, all vaccines were distributed under emergency use authorization. The New York Times says as soon as Monday, the FDA could grant full approval of the Pfizer shots.
It's actually unusual for an application for full approval to be submitted with this much experience, with hundreds of millions of people having received the doses. And there are two things that we've learned during that time. One is that the vaccines are remarkably effective in keeping people out of the hospital and saving lives. And the other is that their safety profile remains remarkably strong.
According to the CDC, about 70% of eligible Americans ages 12 and up have received at least one dose of the vaccine, leaving roughly 29% who have not. And that adds up to 83 million unvaccinated Americans. Murthy says once approval is granted, getting the shot will likely go from optional to a requirement in some places.
I anticipate if and when this does come from the FDA, the full approval, two potential things may happen. One is you may see more people coming forward, those who perhaps were on the fence about getting vaccinated, and this may tip them toward doing so. But second, I think you will see more universities and workplaces that were considering putting in requirements for vaccines to create safer places to learn and work. You'll see more of them likely moving forward on their plans to require vaccines in the workplace and school.
And doctors say the safest way to protect the most vulnerable and children under 12 who have not been approved to be vaccinated is to get the shot yourself. Scientists say the data is clear. You are less likely to contract COVID-19, spread it, or have intense symptoms if you are in fact vaccinated. Rudabeh?